that is quality of life. आप कितना जीते हैं, it's not important. आप कैसे जीते हैं, this is important. So guys, this topic is not about only spinal cord injury. It's all about any major illness. As Dr. Nilima very well said, कि तुम्हारी जान बचाई और तुम सेक्स चाहते हो. Yes, this is important. So, it's not working, sir. Please. The journey start with a young girl, 24-year-old girl, that was engaged, and she came to me with the spinal cord injury. Sometime I always think that God bless you in different manner. After spinal cord injury, she had paraplegia. Later on, she came to me, sir, what should I do? Should I marry? Okay, yes, why not? It's all depends on you and your partner. She started journey. Even I started journey on rejuvenation. And may SCI stop her dreaming? Not at all. Even right now, she's having child. She is now in Paralympics. She was on KBC and lot of things just because of spinal cord injury. So the important thing is rejuvenation for any major illness. May sex and romance be the last thing in the mind? No. Why? Spinal cord injury. Yes, this is extremely disruptive to sexuality. Many people are still able to love satisfying sex life. Physical limitations are always there, but what is important? QOL, that is quality of life. आप कितना जीते हैं, it's not important. आप कैसे जीते हैं, this is important. So for years, people with SCI were believed to be asexual, but it should be high priority. Young people who are at risk of peak in their sexual and reproductive life. Importance of sexuality is not diminished by disabling injury. In fact, all of them would like to have return. So, most paraplegics, they rated sexual function as their priority, and most tetraplegic rated it second after hand and arm function. Sexual function has a profound impact on self-esteem and adjustment to post-injury. People who are able to adapt their changed bodies have satisfying sex lives and very good QOL. So education and counseling, they are important pillar. In pathophysiology part, damage to spinal cord impairs its ability to transmit message between the brain and parts of the body. This results in lost or reduced sense of touch, muscle motion, and sexual reflexes. How these losses affect arousal, orgasm, or fertility depends on the level of injury and whether this is complete or incomplete as depicted in the picture. More indirect causes, pain, weakness, and side effect of medicines. And yes, psychosexual causes, especially with the professional caregivers. Profound repercussion on self-esteem, self-concept, reproductive ability, and in romantic relationship. Depression, body image, and other insecurities. Culturally inherited biases, and lot of body changes and mind changes. So what should be our mission? Our mission should have fulfilling relationship and marriages in spinal cord injury. Now the treatment part. Vivah, a very good Hindi movie. I think sabhi ne dekha hoga. After severe burn, the hero marry with a girl. Same, many with the SCI have satisfying sex lives and many experience sexual arousal and orgasm. By 2 years post-injury, 80% of men recover at least partial erectile function and up to 65% of men have orgasm. more likely to feel desirable and express sexuality. People may employ a variety of adaptation to help carry on their sex lives healthily by focusing on different area. As the erogenous zone may be changed, they may find newly sensitive erotic areas in the like in the erogenous zones or near borders between area of preserved and lost sensation. Around half of the women with SCI are able to reach orgasm. Drugs, devices, and surgery. You all know there are interventions. Women's fertility is not usually affected. People need to take measures during sexual activity to deal with SCI effects such as weakness and movement limitations and skin damage. Now the PDA5 inhibitors. Everybody knows. Yes, they are highly safe, easiest and most common way. So one should count this. Second, medicated injection. It's not my topic. Dr. Threja is there. But yes, it is important, especially alpostadil. Penile pump. Nowadays, it is an old story, but still people are using vacuum construction devices. Penile implant. Dr. Chirag Mandari is here. He will explain you more. Rigid, inflatable, and there are a lot of advantage. Now my part begins. Important aspects of rejuvenation. First thing first, means talking about sex can be difficult. It is very difficult. But it should be in the mind when you are a professional caregiver. You should ask, how's your sexual life? Sometimes many people come, sir, wife bahar baithi hai. I say, no. Ask her, come. And I ask, do you have the problem? Because dono ki problem alag hai. We have to understand. And when we talk about marriage, they are a single unit. They are not different. But they might be different. Their problems may be different. Explain to your patient what they can expect. Keep explaining until they get an answer. Because psychological treatment is very, very, very important pillar of rejuvenation. Now, few important questions about any major illness. Is dating different after injury? Usually the same. But yes, you should increase opportunities to meet people by making yourself available. By dating or by online, by chatting, by any mean. May be different. As person may ask about injuries and ways to deal daily activities. So that should be ready. If someone asks, you should have confidence. You should reply that it may affect me physically, but not mentally and not sexually properly. Also need a balanced dating schedule and caregiver's schedule. How does SCI affect romantic relationship? It's an important study, worldwide study. Marital status at the time of injury, 44.9% individuals are single, 37.5% are married, and 8.6% are divorced. Marriage rate increases over time. In a study of individuals who were injured for 40 years or more, 45.5% married, 24.6% were single, and 22.2% divorced. Normal sexual arousal through two pathways. This is very important part that we have to understand. One is reflex pathway, another is the psychogenic pathway. Reflex pathway, that means arousal that occurs in response to sensual touching. That's why we had a lecture on sensual touch. Then psychogenic pathways, that arousal that occur from psychosexual sensation like thoughts, sights, smells or sounds. In SCI, spinal cord injury, one or both pathways may be blocked. Most people can be aroused by sensual touching in areas like neck, ear, nipple and inner thighs. The more sensation you have in the area between your belly button and the pant pocket area, that is upper outer part of thigh, the more likely you will be aroused in your genitals by sexual thought, sight, smell and all. What can they do if can't get aroused after injury? There are questions that will disturb your mind and your patient's mind. So that's why we are here with the questions. So changing the medication may help, like antispasticity medications, pain medication, antidepressant. They may are contributing factor. They may decrease libido, ED and many more. In women, ask partner to perform oral sex. that may help increase vaginal lubrication. Enough for penetration, using a water-based lubricant may be a good choice. In men, most men get an erection with sensual touching after PD5 inhibitor. If cannot, then other options may be there. What can be done if not having orgasm? Most people with SCI can still have orgasm. Sensual touching may help to achieve orgasm and followed by a decrease in spasticity. Generally, it takes longer and may feel different than it was before injury. In women, vibrator is helpful. In men, often have orgasm with retrograde ejaculation. So again, it needs treatment. Remember, sexual activity can be great fun with or without orgasm. It is important that the person and partner should not give up too soon. Sometimes it just takes time and practice. Does masturbation feel good? Yes. Mainly those with an incomplete injury may be aroused by psychological sexual sensation. In women, a gentle suction device can help increase the ability of clitoris to respond to achieve orgasm. In men, high amplitude vibrator held against the glans may improve. Important precaution about autonomic dysreflexia that we should teach, that we should explain. If your injury level is at T6 or above, watch out for headache and other signs and stop activity, check blood pressure and ask doctor to review medications. Can they have children after injury? Yes, why not? Men and women of all level of injury should decide to have children in much the same way. Consider the demands and challenges of parenting and how to manage. Also, we need professional obstetrician. They are the people, they are trained for spinal cord injury. The positive aspect of parenting usually outweighs the difficulties. Condoms are considered the best as IUCD and pills may have side effect. Do women have problem getting pregnant after injury? This is again important question. There is usually a brief pause in period when first injured. So can naturally become pregnant, carry and deliver a baby in normal response. High risk for common secondary complication but can prevent or manage. Do men have problem getting their partner pregnant after injury? Yes, some men may with SCI can get their partner pregnant through sexual intercourse, but many men cannot. In that case, may be unable to ejaculate in the vagina, retrograde ejaculation may be a problem. In home insemination, it is very good pattern. Collect semen by vibrator, by masturbation, by anything and collect in a syringe and then inject IUI. Then procedures, there are a lot of procedures. How can they help partner to adjust with body after injury? This is again important. Understand body faults. It's a unique. So issues are unique too. It can take time to understand how body works and manage problems. They should take time to figure out where each of them finds pleasing and exciting. What they did before injury may work for them. If not, person or partner can be creative and open to exploring new ways to find sexual satisfaction, as Dr. Sita very well explained today. Using humor and being playful are keys to having a more interesting, enjoyable, and mutually pleasurable experiences. Keep an open mind along with an honest and open line communication. Problem arises when there is a communication gap. So I always says, a very good movie, Das Vidaniya, agar kisne dekha ho. So in that a very good quote, कि पहले जब हमारे पैर टकराते थे तो सब शिकायतें दूर हो जाती हैं, अब गलती से भी हमारे पैर नहीं टकराते. So where the problem starts. So communication is always and always key for a good married and sexual life. And I always says, a good married life starts with good bedroom habits. In any relationship, if bedroom habits, if sexual habits are very good, their married life will be superb. So this involves self-awareness and possibly self-exploration. They may like experience a few setbacks communicate and listen to each other. The goal is to talk about any issue or concern, about work together to solve problem and resolve concerns. Now, how to keep the romance alive if partner is also caregiver? This is a very important part. Do everything to keep the role of the caregiver separate from that of a romantic partner. You have to change nappies, you have to change diapers, you have to do everything, but this should be separate and your romantic relationship should be separate. I know there are a movie. In that, the lady says, what you expect from me? Whole day I should take care of your family, your kids, and रात को मेरे body में से खुशबू आनी चाहिए. How you can expect? But this is important. Everyone should understand that feelings are always and always important. So just separate your caregiver part and your romantic relationship part. Be as independent as possible. Have set times when caregivers works are needed and where other times are needed. Keeping these roles separate will help to avoid confusing. Romance when you are the partner of SCI survivor. This is again important. Resentment is almost inevitable. It is with everyone. Taking the partner on a special outing, plan something different, complimenting him or her every day, but not for achievement related to SCI, but related to your sexual life. Telling the partner how attractive they are. Sometimes your partner want to listen from your side. बहुत बार आप ये देखिएगा शिकायतें रहती हैं फीमेल्स को कि आई वॉज इन द पार्टी पीपल नोटिस मी पीपल कॉम्प्लीमेंटेड मी और तुमने मेरी तरफ झाँक कर भी नहीं देखा. दिस इज़ वेरी इंपॉर्टेंट पार्ट. सो एटलीस्ट when you reach to the home, your single comment may improve your sexual life. Surprise your partner with a gift or outing. Communication, communication, and communication. And these are the key to long-term relationship and romance. Thank you. Thank you for the journey after successful rejuvenation.
Thank you, sir. Should we go for questions?
I think आपने तो काफी पूछा है कर. You also had a chance.
I have two quick questions. The first one is, you mentioned that syringe could be used for IUI. I wanted to know whether yours or anybody has such experiences where they can apprise us as to what is the success rate of this kind of a thing. And secondly, I was working in Indian Spinal Injury Center, Vasant Kunj, Delhi. The two most important things, the two most important measures that we used to employ there was vacuum devices and, of course, the penile injections. So what is your say, what is your take on that?
Yes, sir. First, if I talk about me or what we should do, we should take help of our obstetricians because they will explain in a better way. It's just, I given an example what we may do in a simplified way. But as a professional caregiver, I will never suggest that we should use syringe. There are a lot of many ways. It was just to explain the patient. I just tried the simple words that how you can explain to your patients. But of course, gynecologists have a lot of very good choices and methods that we should use. And same in my setup, I just refer them to my gynecologist, my gynecologic friends, so they take part. So it's not my part, as I left many slides, that's not my part. So we may take help of other our fellows. That is my concern.
I would like to answer that question, first part of the question, that is regarding the insemination. There are two types of inseminations at home. One is neat semen. Just ask the couple to collect the semen as soon as he ejaculates, and with the help of syringe, just inject into the deep part of the vagina, because the neat semen should not be directly injected into the uterus. If you inject directly the neat semen into the uterus, the prostaglandins will cause severe spasm of the uterus and there will be severe pain. And neat semen should not cross the cervical barrier because of so many other reasons, including the bacteria, cells, pus cells, etc. That cervical barrier should not be crossed with the neat semen. That is one thing. Second thing is, if you have got the facility of a laboratory nearby you, you can ask the semen to be processed, that is centrifuged and separated, that there is a separation itself, a process itself that is called as semen preparation. So go to the lab as soon as possible, get it processed, then with a small catheter, if you can inject directly crossing the cervix into the uterus at home, you can do. Or take the help of a gynecologist or a healthcare provider, and then that becomes regular IUI. So one of these two things can be followed, and the success rate is about 18% per insemination in neat semen, and about 22 to 25% with processed semen per insemination, provided done on the day of ovulation.
There are studies where the persons just the partner ejaculated and the female partner collected from the spoon, and the patient get pregnant.
Sir, I am Dr. Abhinav from Patna. I am a rehabilitation physician. So if a patient who are with the spinal cord injury, one of the common social problem is the infidelity. And it is quite prevalent. I can share with you with the experience of managing about 1,000 patients. Now, one of the common problems, if you mentioned about autonomic dysreflexia, the patients with injury above T6. So if a partner, whoever is injured will be lying supine and the other partner will be on top. If the partner is on top, it can cause some pain or a noxious stimulus, which can lead to the autonomic dysreflexia. So your take on that, how to manage it. And another thing is regarding this pregnancy in the female. One of the common problem with the patients who are female with a spinal cord injury, that these pelvic muscles become weak. So there is always a risk of premature delivery. So this is something which I would like to add, which one has to be careful.
Yes, sir. Very agree. That's why I asked that we should contact with the trained obstetrician who are trained for the spinal cord injury or other major illnesses, because this is not problem with spinal cord injury. This is the common problem with many other illness. So many gynecologists deal with the issue. So I don't think it's a very big issue regarding pregnancy. Yes, regarding autonomic dysreflexia, the mainly thing when we use vibrator or any kind of machines, like where we cannot control the vibration, then the problem occurs in major cases. So there are a lot of ways to manage, like change in the positions, change in the strokes, they change in the speed, change in the pressure, then you can manage the problem. It's not a very difficult. Yes, 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 yes.
I think he has taken out the topic how to manage sexual like disorders, especially in the spinal injury. But when we treat the patient, we refer to the particular specialist, maybe a neurosurgeon, maybe a gynecologist, like that, you know. So this is like, you know, better. It's just a guidance of the topic, I feel so. Okay, so going ahead, thank you so much, Dr. Akhil, for elaborating such on this topic. And here I invite Dr. Ajay to felicitate Dr. Akhil as well as Dr. Varun. Yeah, and please, chairperson, please be on the stage.
Yeah, light dim kar dena.